Now, and as you said, this is in joint presentation with Dr. Varsha Potdar. Um, Whenever you think of a space mission, you think of ISRO. I think whenever you think of COVID, you think of NIV and ICMR, and both have done excellent job and made India proud of their institutions. So now Dr. Potdar said that she would answer questions, and we have three questions for her. Are you there, Dr. Potdar?
Yes,
Dr. Varsha?
yes, very much I am here.
Yes, Dr. Varsha, of course, Dr. Nivedita made a lot of things clear, but we wanted to get your feedback on do you agree that there is a resurgence of COVID-19 in now there's a resurgence?
Yes, Dr. Ashok. As Dr. Nivedita has shown the what we are conducting right now year-round surveillance for influenza and SARS-CoV-2 since 2021, and there is a clear-cut upsurge of COVID cases in 2025 since first week of April, we can say, and slowly and steadily the numbers are increasing. That is in comparison with the last year 2024. So definitely there is a increase in positivity for COVID, but again no worries, because as all the panelists has already explained that these are mild variant, though it is a Omicron itself, but the infections are mild nature, and there is no severity as such observed, or uh, where we can underline the situation. So, yes, there is a surge right now for COVID cases, and one should be vigilant for this to handle these cases. One should be vigilant for that, and also practice the COVID appropriate behavior. That is for beneficial for the community also, not to spread further.
When COVID was ebbing in 2022, people talked about triple pandemic. That means there would be influenza, COVID-19, and RSV. And of course, as Dr. Nivedita mentioned, you're already doing surveillance. Now, the question is, should we then lead that into our preventive steps also? Because I think what is emerging is influenza is more important um, to prevent. And somehow India seems to be neglecting influenza and stressing more on COVID. What are your thoughts on that?
Yes, sir, absolutely right. Influenza is a bigger problem, as Dr. Nivedita has shown in her slide, the clinical presentation of influenza and as compared to SARS-CoV cases. And we saw that there is a at least six-fold severity increase in influenza cases. One thing is good for influenza is, yes, influenza changes every 6 monthly. Influenza strains get changed, so one should be. That's why the surveillance is very important. We need to identify these strains, and we are also sharing our data to WHO for vaccine selection criteria. So India is very well represented in WHO vaccine selection process. This happen twice a year. One is for northern hemisphere and one is for southern hemisphere. And for both the seasons, we are sharing our data to WHO for the consideration. Of course, influenza has a kind of antivirals available, and also the vaccines which are effective. So definitely, we should now encourage for influenza vaccination along with when we are talking about SARS-CoV. That, that now it is in a post-pandemic phase. For COVID, we are in post-pandemic phase, but influenza has a always is a pandemic potential virus, and one should have a vigilance for influenza circulation and identification, sir.
While watching the vaccine war movie, when I saw people in NIV, I felt that they had some message to give to the microbiologist and how NIV can be of greater help. Maybe now that we have the time and the opportunity, what would you like to say?
Yes, sir. NIV is always on forefront for whenever there is a any outbreak scenario. As a and we work together like you said. ICMR NIV is on forefront for handling outbreak scenarios. We are very much into capacity building in other times when there is no emergency or something. We are always in preparedness mode because that is one thing has to be there for the nation. And if you are considering the respiratory viruses like influenza or RSV or SARS-CoV, we are always in vigilance that whether there is any untypeable or unusual scenario is happening in the country. So we are always kind of on forefront to handle this situation. Apart from that, we have also enhanced the capacity of pan India surveillance network for not only for diagnosis but for virus characterization, antigenic and genetic characterization. We also provide lot of trainings on right now for genomic analysis. So that is the now way forward. More countries are into right now genomic surveillance rather than the only surveillance doing with the real time PCR or something. So naturally, more insight for the what is in circulation, what clade is in circulation, what are the mutation pattern in these viruses. It's very important to know, and that's why if you talk about NIV's role for the nation building or capacity building, yes, we are doing that. And now under this national One Health mission, also we are conducting lot of trainings. We have had this created this BSL 3 laboratory network, which will be of use in future pandemics or in any outbreak scenario in or any emergency situations. So definitely, this capacity building, national capacity building is very much on top priority for NIV.
Excellent, ma'am. It's let me tell you once again that we are very proud to have you here with us, and both ICMR and NIV